Today we are going to learn about the cardiac plexus. This is the superficial cardiac plexus located below the arch of aorta and anterior to the pulmonary artery. And now we will see how this plexus is formed. Concentrate that on both sides of the vertebrae in the cervical region we have got a chain of sympathetic ganglia. This is the superior cervical sympathetic ganglia. This is the left one and this is the right one. They are formed by the fusion of cervical 1, 2 and 3 sympathetic ganglia, right? Okay. Then comes the middle cervical sympathetic ganglia, again formed by the fusion of 4th, 5th and 6th cervical sympathetic ganglia. Then we see the inferior cervical sympathetic ganglia by the fusion of 7th and 8th cervical sympathetic ganglia, right? And when this inferior gets a chance to fuse with the thoracic 1 sympathetic ganglia, now this is called as cervicothoracic trunk, and due to its shape as a stellate, it is also called as stellate ganglia. You can see bilateral presence of these cervical ganglia and thoracic as well. So what we have to learn, we have to see that the cervical ganglia, they give rise to branches towards your heart and take part in the formation of superficial as well as deep cardiac plexus. And the upper 4 thoracic sympathetic chain branches also contributes in the formation of the cardiac plexus, right? Okay, which is deep in location. Now see the location of the deep cardiac plexus. This is basically lying behind the arch of aorta. Just for making you easy, it is shown here, and you can see the bifurcation of trachea. It is just present anterior to the bifurcation of trachea and posterior to this aortic arch, right? This is a larger one and receives more branches. Now concentrate that the yellow color vertical running nerve is the vagus nerve. This is the left and this is the right. And you can see running downwards various branches. So let's start from the left side. The left vagus is going to give the upper cardiac branch, and the green one is the lower cardiac branch on the left side. Right side, again you can see the upper and the lower cardiac branches, and just below them on both sides you see in purple the recurrent laryngeal nerves. Okay, now from the left side, the lower left cardiac branch, which is shown in green color, is taking part in the formation of superficial cardiac plexus. Now concentrate the left sympathetic chain. There is a branch marked in a green color starting from the left superior cervical sympathetic ganglia running downwards and taking part in the formation of superficial cardiac plexus. So simple that as it is minor and the left-sided branches are taking part in it. The left lower cardiac of the vagus and the left superior cervical of the sympathetic chain, they just 2 in number and take part in the formation of superficial cardiac plexus. Now what happens to the deep cardiac plexus? All of the rest branches coming from either side. Let's see a branch from the middle cervical, inferior cervical, and from the T1, T2, T3 and T4. They all are coming towards the deep cardiac plexus. Even this, now concentrate the left recurrent and right recurrent. They are also taking part in its formation. And the leftover branches of the vagus nerve, the upper cardiac from the left side, and on the right side the upper right cardiac and the lower cardiac, both are taking part in the deep cardiac plexus. Now on the right side, the superior, the middle and the inferior, and the T1, T2, T3 and T4, they all are taking part in the deep cardiac plexus formation. Now the branches from this ganglia sympathetic, they are post-ganglionic. Either they are entering into the superficial or into the deep. But the branches that are From the vagus are the preganglionic, they come over here and then they finally enter into the ganglia that are buried in the adventitia of your heart, and along with the vessels they come over there, and from the buried ganglia postganglionic fibers are going to supply. Now we have to learn that there lies the SA node in the right atria and AV node at the lower part of the interatrial septum, and then the bundle of his left bundle branch and the right bundle branch, right? This is the conducting system of heart. Now your autonomic nervous system, formed by the sympathetic chain and the vagus nerve branches, they are supposed to modulate or affect the pacemaker activity. Means that this pacemaker or conducting system is a generator and the autonomic nervous system is just supposed to control it. Okay, not initiate but control it. So let's see what it does. The sympathetic system, it activates the fight, flight and fright response. So it increases the heart rate, the contractility, and for this oxygen is more needed. So it causes vasodilatation of the coronary vessels to provide more blood to your heart, right? Okay, when the parasympathetic or vagus nerve is activated, your heart rate is decreased, contractility is decreased, and the blood vessels or coronary vessels, they are constricting to conserve the energy, right? So this is the phenomena, and now we know that the sympathetic system is taking help of the adrenergic chemical mediator and the beta 2 blockers in your heart, and the parasympathetic system is using acetylcholine and the muscarinic receptor for their action to be done. Okay, now I think it would be much easier that you have learned about the nerve supply of the heart, that how the superficial and deep cardiac plexus are formed, how the autonomic nervous system branches are taking part. Let's repeat that the superior, middle and inferior ganglia are present bilaterally. Then comes the T1 to T4 ganglia. They are supposed to give branches to these plexus, and then there are vagus nerves on both sides having the upper and the lower cardiac nerves, two on both sides, and the recurrent laryngeal nerve, they are also taking part. So let's revise that superficial cardiac plexus is formed by the left lower cardiac branch of the vagus, and the left superior cervical sympathetic chain is giving rise branch to it. And for the deep cardiac plexus, all of the rest branches take part in it. Thank you very much.